In this video, we are going to be discussing the key question, safe. So is your service safe? More specifically, we're going to be looking at safe systems, pathways, and transitions. So the related quality statement is we work with people and our partners to establish and maintain safe systems of care in which safety is managed, monitored, and assured. We ensure continuity of care, including when people move between different services. So in simple terms, this is about collaborating with both individuals and our partners to make sure that healthcare systems are both safe and reliable. The goal is to actually guarantee that people receive consistent care even as they transition from one service to another. The key points are making sure that we have safety and continuity, making sure that we have a collaborative approach, making sure that we are aware of all risks, so basically having proactive risk management, having collaborative planning, and valuing input, so making sure that everyone is actually heard, specifically and most importantly, the people that we care for. So now I'm going to read the related I statements. So the first one is, I know what to do and who I can contact when I realize that things might be at risk of going wrong or my health condition may be worsening. And the second one is, when I move between services, settings, or areas, there is a plan for what happens next and who will do what, and all practical arrangements are in place. This basically means that the people that we care for should feel empowered in their healthcare journey, and if they do sense that something is wrong, then they should feel enabled and empowered to take action. The second part of the I statement is more around the transitions between services and making sure that the people that we care for have a smooth and safe as well as consistent transition from one service to another. The key related regulations are, so Regulation 12, Safe Care and Treatment, Regulation 18, which is staffing, and Regulation 19, which is fit and proper persons employed. CQC will gather feedback from people's experience and feedback from staff and leaders. They'll also look at your processes, and if you're in a care home or supported living setting, then they'll look at observations. What are the recommendations? The first recommendation is being able to evidence that you are providing safe staffing levels at all times. So the way you can show CQC that you have safe staffing at all times is, number one, you can obviously display this through your rotas. Number two, you need to be showing this through your risk assessments as well as your care plans. So if a particular service user has heightened risk at a particular time and they need one-to-one staffing, two-to-one staffing, etc., then you can show this through your risk assessments and details to what are the risks and why they need that particular staff member. And again, you should always reflect this in your care plans also. The way you'd be able to show CQC that you don't have an over-reliance on agency staff is, of course, through your rota again, by displaying that, you don't have too many staff members within your service that are from an agency. Again, you can protect yourself by making sure that you do have a solid, bank of staff. If you do have, a good team of staff, that's amazing. But ultimately, people do let you down. We are in the human business. And so it'd be a good idea to have a bank staff or a bank staff team. And if at any point your staff member's calling sick, then you can always call through to your bank staff and see who can pick up a shift. Thank you so much for watching this video. If you've enjoyed the video, then please like, subscribe, and press the notification bell so that you are notified anytime we upload a new video. Thank you so much. We'll catch you in the next one.